Alrighty, well, good afternoon, and thank you very much for your patience and for being on this special webinar that we are hosting today with Devoted Health. And I have a special guest with me, Miss Jeanette Velez, who you should be able to see on your screen there. And she's going to take over about halfway and talk about all the great things Devoted. I am Justin Jacobs, the owner and principal agent of Health Plan Markets. We are a full-service FMO agency out to serve you, and we are here to explain our partnership with Devoted Health. So I am going to introduce you to our team here at Health Plan Markets. Just as a reminder, we do have a website, joinhpm.com. You can find all the information that I'm going to talk about today on our webinar, including this wonderful video that you see here. Unfortunately, the video is not sharing the audio right now. So just take a moment, go to joinhpm.com. I'll also send you a link to the video later on in an email so you have that and you can take a look at it. So I'd also like to introduce who is on the call, Mr. Sergio Diaz. He is our Vice President of Sales and Marketing. So Sergio, if you can introduce yourself and tell the wonderful people what you do at HPM.
Good afternoon, everyone. My name is Sergio Diaz. I'm the VP of Sales and Marketing for Health Plan Markets, and I'm here to give you the support with marketing, training on sales, and make you successful. That's what I'm here for.
You. Thank you. He's also really good at spending money. Marketing is our party, right? So he's in charge of our sales and marketing team, including Victor Crumity, who is our sales manager, and he helps out in the field. So if you're jammed up at an appointment, let's say Jeanette is in a meeting and is unavailable, Victor is there to answer questions about Devoted Healthcare or any sales questions that you may have. He has years of experience selling out in the field, Medicare and ACA, so he can help you with both of those product lines. Ms. Jessica Curtis, who peeked in at your video there, Sergio, I saw she was in the room with you. I think she wants to be famous, but Ms. Jessica helps us with our contracting. So she's your first stop. She's the person that when you come on board, she's going to handhold you through getting set up with Devoted Healthcare and making sure that your contract's properly filled out, your training is done, and you are ready to sell. She then hands you off to Jeanette, and Jeanette takes over from there and gets you all the information that you need to start selling Devoted. At Health Plan Markets, we have our own IT manager. Yes, Jonathan is on loan from Apple right now. I'm just kidding. John helps us with all of our IT needs. So if you have an issue with your email, we set you up with an email here. He can help you with the e-applications, reporting your sales, the CRM system, which we're going to talk about. But we have our own guy here, so you're not lost in trying to fix these issues over the phone or online. You can actually physically come in the office if that's better for you, or he has the capability of taking over your computer and getting it done for you, so that's pretty cool. We also have Tom Ryan, who is on board to help us with training and development. So if you're new to the business, or if you're new to Devoted, or you need help with marketing, Tom's your guy. He's been in the business for many years now. He came from another health plan as a broker manager, broker liaison, so he very, very much understands the broker world. Wonderful guy, and he is here to make sure that you are winning contracts. Cindy is also here. You'll hear from her. She's our admin. She's also agent support, so she'll reach out weekly to see if there's anything we can do to help you. If you need business cards, your car magnets, your pull-up banners, any marketing needs, or if you even need kits, she can gather those and get those ready for you at the office so you can come and pick them up, or we can ship them down to you, whichever's clever. So you have agent support. Kim also handles agent support as well. On her team, she handles a lot of our folks that are out of state, or does mostly the remote side of it. She also handles our telesales department. So Kim, she helps you set your appointments for your clients. So every year around AEP, she gets ready to call books of business and sets those appointments for you so you don't have to burn your valuable time on the phone setting up all those appointments. She can get it done for you. And that's our team. Here's our office here. We're off of West Colonial Drive and Hiawassee in Orlando, but we can help you remotely. So right now our traffic is slower at the office, but we're used to doing business remotely. So wherever you are in the world, we can still serve you. But we do have a physical office here in Orlando and a office in Jacksonville, which is freshly branded. So if you're in either one of those areas, you can pop in and grab kits, marketing supplies, and anything you need to succeed. So it's very, very important with both of those locations because both in Orange County and Duval County, Devoted is a brand new plan in those areas. So we'll have lots of action there. So what are some of the biggest issues that face independent agents? And besides feeling alone, there's lots of things such as infrastructure that is missing when you're a fully independent agent. And we're going to go through some of those things that kind of make you feel like you're on an island by yourself. And we're here to help fill those gaps. Our tagline this year is be independent, but not on your own. With Health Plan Markets, you have an entire team behind you, which I just showed you. And we are here to support you and make sure that you've got everything you need to go out there and sell and to also retain your membership, which a lot of FMOs I think skip over because it's not all about sales. It's mostly about retention. You want to make sure that you've got great intention. But what's our recipe? What really makes HPM shine? And I'm going to show you our recipe here. And the first thing is you're going to realize that you're going to have a personalized agent experience. We understand that not every agent has the exact same needs. Everybody's slightly different. Whether you do marketing with physicians or all you do is mail outs or maybe you just do digital marketing, we understand that every agent needs specific materials and tools and resources. So when you onboard with us, we understand that you're not going to be like your agent friend. Everybody does the business a little bit differently. We are a technology-based organization. I'm going to show you all the great tools that you have. But I think one thing that really helps us shine, and I had a great conversation with Cindy this morning, is our helpful culture. We're not just here to, be alone. I think that, and you're going to hear from some of our agents on what they say about that helpful culture because we're here to help each other. If one agent figures out, hey, I just did this and I got 5 sales, we want to hear what that is, so we share it with the team. So we're not on our little corners of the world. And as you onboard, you're going to realize that we've really built a great culture here at Health Plan Markets. We have great results-driven partnerships with both our health plans, such as Devoted Healthcare, and our physicians. We have doctors that we work with that help us with leads, events, and marketing. So this is a great opportunity right now. We're going to share some of those relationships that we have. But also part of our relationship is appreciation. I know personally what it's like to go out in the field every day and hunt for business. It's not an easy job. It's even harder to retain your business. You've got to be accessible. You've got to stay in touch with your members. And that's a lot to do without an entire team behind you. And I know what that's like. So we love to show appreciation to those agents that are out there doing those sales. So that's really our recipe, and that's what I feel makes us different than the next FMO across the street. And it's all about teamwork. We understand that teamwork wins championships, right? Communication and partnership is what really defines Health Plan Markets. So, whether or not you prefer to get emails or you prefer to get text messages or you prefer a personalized phone call, whatever your communication style is, we listen and we help you out with that. Here's a couple of reviews that our agents have left for us recently on Google. Tanisha, she goes by Tina. She says, love HPM. I can truly say they are the best agency to work with as an independent agent. They provided me with the trainings and assistance I needed to be a success in the field. Kudos to the entire staff. And Kelly, he said recently on Google, I have been with HPM for 4 years now. I find the staff to be extremely proactive in helping me in all areas of support, and my fellow agents and I are always willing to share best practices and ideas with each other. Thank you, Justin, for showing true and authentic leadership. And that just goes back to what I was saying earlier, that we try not to hold secrets from each other, because you might find something that would be super helpful, and I want to make sure that we share that with the team. Here's a few things that we've got on deck. I'm not going to go through all of these. I'm just going to touch on a few of these, especially our CRM system that could really help you. So first things first, as far as marketing goes, we understand that right now it's a little bit difficult to do business. You've got, some clients are not willing to meet with you. They want to do everything over the phone, over emails, or however you guys are doing it remotely. So we have started building personal websites for each one of our agents. So you will get a free landing page, and that will help you generate online leads and enrollments. So you'll see here, this is an example of Mr. Mark Oster. He's got his name, his phone number, his email address on the website, a little bio that talks about him, and a quick video that explains what an independent agent is. We're also putting together personal videos, so kind of like a little commercial for yourself, and you can quickly send out a link to anybody that says, hey, I just need a little bit more information, Justin. You can send them to your website. Brand new, we have just set up Connecture. So Connecture is an online enrollment tool that allows you to send quotes and do enrollments online for Medicare Advantage plans and Medicare supplements. We have a secondary system called Health Sherpa, and Health Sherpa is designed to do enrollments and quotes for individual and family plans on and off marketplace for those of you that are doing Obamacare. But, and I won't give away the goose on this because Jeanette has a secret about Connecture with Devoted. But Connecture is one of the platforms that we use for enrollments. So if you're familiar with that, you'll have it with us as well. We have a few tools that I wanted to share with you today because these are things that I feel really make us unique. We have an app that allows you to track your book of business. So when you're done doing an enrollment, you just pop it into the app and it goes right into the CRM system. This gives you the ability to stay organized, leverage your relationships with doctors and plans, and this is super helpful. And I can tell you that Jeanette, she calls me and she says, how many sales you got? And so I can quickly look into the CRM system and say, hey, guess what? Justin did 3 sales for you already this month, so what are we doing for Justin? And the best part is it's already marketing ready. And what that means is AEP's coming up, right? And you're going to have to send out your letters, and you're going to have to call your people, and you're going to have to send your emails and do your blasts. And if you don't have all that information in one place, if you don't have it on a spreadsheet, the systems aren't going to read it, and you're not going to be able to get that together. So within 8 seconds, we can pull books of business and have it ready to go to the mail house. So it is completely done for you, paid for, out the door, and your clients are contacted with you and for you with your name, your picture, your cell phone number, and your email address. So all that's done. But it's a great way to also see trends, and we do contests for enrollments as well. The trends are important so you can see, who's the doctor I'm enrolling the most for, or what areas am I getting most of my applications from, or what's my #1 lead source. Sometimes we think we know, but then when you see the data, it's really interesting. We have a customer relationship management software that is our CRM system, and you'll have access to this customized CRM system. So obviously it's there to manage your clients and leads, and it's done for you automatically. And as of right now, we are offering the CRM system for free, no cost to you. And at one point, we had it up to about $100 a month. But, I know that there's other FMOs out there offering CRM systems, but ours is pretty incredible. So I'll ask you this. What if you can access your clients 24 hours a day, 7 days a week? What if you got reminders to follow up automatically with your clients? What if you had a daily to-do list laid out for you automatically every day. You can keep all your notes for each one of your clients. And what if the system automatically sent out a personal birthday card and a thank you card all done for you and emails? I mean, think about how much time and effort that would save you if you had a system like that. Well, it's here, and it's available to you at no cost. So our CRM system is pretty amazing. And as you come on board, we'll train you on all the great things that it does. This is our training calendar. We have a training calendar that is available to you. Why is training important? Because things change all the time. I have a saying, you have to have one foot in the classroom and the other one in the field. I've been in this business for 15 years, and every year things change. And so you're just going to have to learn, what trainings do I need to go to? How do I do a Facebook training? Or how do I do Medicaid? Or I need to learn Devoted's e-application. How do I do that? And so rather than bouncing around to the different carriers and all the different live and online trainings, it's all organized in one training calendar that you'll have access to. So this is a really great way to ensure that you're staying on top of your training. We also have a tool called our Gold Key, and the easiest way to describe this tool is imagine on your laptop, your iPhone, your iPad, your computer, whatever you've got, you're able to access all of the documents that you need to do a sale. So with Devoted, you've got slideshows, you've got sales videos, you've got formularies, summary of benefits, directories, you've got extra help documents, all these things are all over the place. Well, you're going to have all of these tools organized in a folder available at your fingertips 24 hours a day, 7 days a week. So you can do a full compliant presentation from your cell phone. I have done that. I've had to do that at one point. But you have these documents. And anytime that if Jeanette sends me the 2021 information, we pop it in the folder and you get it automatically on your phone. So I'll tell you a couple other examples. I'm driving in my car, a client calls me and says, "Hey Justin, what's that copay for the surgery?" Well, in the old days, I'd have to pull my car over, jump in my trunk, dig through my trunk, try to find that Devoted book, open it up to the page, and then I'm on the side of the road for 10, 15 minutes. Now I pull my car over, I look on my phone, jump in the folder, and I've got the answer at my fingertips right there. And you can send all these documents to your clients. So if you wanted to send them the sales video or a scope of appointment in an email, you don't have to dig around for it. You know right where it lives. So incredible tools that make it easy for you to do the business. So let's talk about some of the Devoted opportunities that are out there. And I'm just going to talk from our experience on HPM because Jeanette's got a lot more to offer you. But I know that we will be doing seminars and or webinars for 2021. We're already working on that plan. She's got a program for Devoted Bucks. You also get additional credits with HPM as you start doing business with Devoted. As those applications come in, they have marketing dollars available to you to help you grow your book. And we have some exclusive partnerships with key physician groups and key doctors, and we help assign our agents to those doctors. So, if Devoted has a new group that comes in, they usually call us and say, "Hey, I need a doctor for Dr. XYZ's office." We go over there, we introduce you, and we get you linked into that doctor so you can start a relationship and start getting leads from that physician, but also to help them grow their practice and put your clients into their practice. So we look for two-way relationships on that. Here's some of the relationships that we have at HPM. So you can see some of the doctor groups you may be familiar with already. Devoted has many more doctor groups, but these are just a few of our select relationships that we have. I can tell you that Physician Partners is our largest partner, and they're spread out all over the state. So they have offices everywhere, and our agents are doing business with those doctors on a daily basis. Let's talk about money real quick before I hand it over to Jeanette. So in Medicare, we're all getting a raise next year. I don't know if you've heard that, but it is going up again. I have the numbers, but since it's not an official document, I'm not going to send it out. But right now for 2020, if you have 393 clients, which doesn't sound like a lot, 393 clients. You're earning $21.25 a month. Your lifetime renewals is $100,000 per year. So as a reminder, if you write somebody today, next year when the plan renews, you get paid every month, every month, every month. So that concept of renewals can help you get there. And this number is coming down, and these are just Medicare numbers, not to mention any other products that you might do. The reason we're in this business and the reason we like Devoted is because they have lifetime renewals. So you write somebody this year and they're on the plan for 5 years, you're getting paid every month for 5 years, and that's what we love about doing this business. Is this a get-rich-quick scheme? No, it is not. It's not going to take you a year to get to 393 clients. It might take you 2 years. It might take you 18 months. It might take you 3 years. It just depends on how fast and furious you go at this business. Some of you are well over the 393 limit, and we commend you for that. And some of you are just getting started, and we have everybody in between. So we understand that there's different folks on different ends of the spectrum. But this is an incredible opportunity because every day people are turning 65. It's still at about 10,000 people turning 65 every day. So the opportunities, you don't need 10,000 clients. You only need less than 400 clients to make a six-figure income in this business. And then one last thing about the money is, you know, we're in a pandemic right now, and people are very unsure about what's going to happen in the future. And I can tell you right now that the agents that have worked in the last year or two and helped build this business for themselves, they don't care if we're locked down for another month, 6 months, or 8 months, because they're getting paid every month whether they write the business or not. So their focus right now is just ensuring that their clients are taken care of and their clients are happy. And I couldn't be more excited and more fulfilled to hear those stories than I am right now from the agents that have been there and have really, really built a business where, you know, now that we're in tough times, it's okay for them, you know, so they don't mind. It's like being on perma vacation. All right, so how do we get started here? We are currently in lock-in. Lock-in started April 1st to September 30th. You may or may not know that COVID-19 has allowed us a Medicare SEP, so you can actually write business today for 7/1 effective. It is a special enrollment period. But this is the time that you want to start getting your contracts done. Certifications have already started rolling out. AHIP rolled out on Monday. And you want to get these things knocked out and done, because you don't want to be sitting on it until September or October, where you should be doing your marketing and you should be doing your sales. So we're getting our plans together, we're getting our contracts done, we're getting certified, and marketing begins on October 1st, and you can start marketing the plans. And then October 15th for Medicare, that's when we can actually turn in applications. We also have OEP in January 1st to March 31st, and this is a great time to do your retention and also to follow up on any leads that really didn't get back to you. You still have one opportunity to get them enrolled. So that's the cycle there. That's basically how it works. And with that, I have Jeanette, and Jeanette is our sales manager here in Central Florida, and we do understand that some of you are in other areas of Florida, so we're not going to talk benefits specifically. We're going to talk high-level overview for Devoted, and then as you come on board, we're going to link you up with your local manager so you can have a look at the benefits for both 2020 and 2021. So with that, I have Miss Jeanette. I'll let you take over.
Hi, thank you, Justin. Good afternoon, Devoted team. My name is Jeanette Velez. I'm the sales manager for Orange, Osceola, and Seminole County. Currently, we have a few new markets that we're opening into, and Lake County would be one of them. Orange is another. We're heading up into Jacksonville and several other counties. But today we're going to be talking about Devoted Health specifically. And if you've heard about Devoted Health, please send us a message in the chat box. If not, we're going to talk about Devoted Health today. So Devoted Health is just 3 years old, and our mission at Devoted Health is that we want to make your clients' health care easier, more affordable, and a whole lot more caring by treating them like family. And I will tell you that before I started working here, I sold Devoted Health, and they actually do treat your clients like family. It's a company that you've never really seen before as far as the way they operate, and we're going to tell you a little bit about how we do that. So a company was founded by Todd and Ed Park, which are brothers, and I would kind of call them serial healthcare entrepreneurs. They were the team behind 2 public companies, and after they sold those companies, they founded Devoted Health. They want to change healthcare, how it's paid for, delivered, and experienced. I'm just going to quote you their mission right now so that you can, the one that you can find on our website. I encourage you to go to devotedhealth.com and browse through it. It's a super easy platform. One of the things that Justin and I have in common, or our companies have in common, is that we're both high-tech companies, and we have everything at your disposal for ease of use and being able to just get everything at your fingertips. So their mission statement is, we've gathered together a bunch of smart, big-hearted people from healthcare, tech, retail, and beyond, and the kind of people who thrive on challenges that matter. That's what it means to be devoted. Healthcare is broken, and fixing it is messy work. So people say it can't be done, it's too big, it's too much, but we're saying that they're wrong. So I think that's really a very unique mission statement. On the next slide, you're going to see that we have the 2 people that I was just talking about by Ed and Todd Park in 2017. Our first membership was in 2019. We raised over $300 million. We built for a rolling 20-year time horizon, so we're here to stay. We're not going anywhere. We're not selling. We are agile, willing to adjust, and listen to feedback. We believe that we can make an impact. We believe that with clarity of thought, commitment, and persistence, we can change the world. So there's a quote that I want to give you from Margaret Mead that says, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." And I truly believe in our CEO and co-founder that we're going to do it. Our next slide here is going to talk about why are we doing this. Well, we started with a simple question. Is healthcare today confusing, expensive, impersonal? Really the best we can do? Of course not. We definitely can do better. We built this company from scratch, and everyone wanted to know, why not buy an existing plan? We decided that we didn't like the way healthcare was delivered and that we were going to change the face of healthcare. We generated tremendous interest from investors, so everyone, and so we started this organization, and we really want to emulate Amazon. So you either love or hate Amazon, but we can't deny that they're the biggest online retail company, right? So everyone is familiar with them. Part of Amazon's vision statement is to be the Earth's most customer-centric company. And we really want to build that same model. And that is to be the Earth's most member-focused healthcare organization and treating everyone like family. So our next slide, you're going to see, like I mentioned, Devoted has set out to build the plan we'd want for our families. And one of the things that we're proudest of is that we've managed to do it. A lot of our teammates, my colleagues, have placed their loved ones on Devoted Health, and they say they never would have done this before for any previous clients that they've worked for. So that's pretty cool. On the next slide, you're going to look at our growth. So who is Devoted? If you've never heard of Devoted, if you have, please just send us a message in the chat box. Our growth has been unbelievable. For 600% growth from January 19 to January 2020. Currently, we're the fastest growing health plan in Florida and Texas in the last decade and plan to expand nationally. Okay, so we outsold any of the health plans here in our markets in Florida. We have almost 19,000 members now, and we're still growing. We're expanding into Ohio, Arizona. We're already in Texas. So we've got a lot to grow, and we wanted to give you an idea of how quickly we're growing and want you to be a part of that growth. The next slide is basically, these are the 5 ingredients, our 5-layer cake we call them, that makes for devoted success. So the first one says Next Generation Medicare Advantage Plan. The second one is Devoted's Tech and Data Platform, which is called Orinoco. And our third is partnerships with our value-based providers. Fourth is our Devoted Health Guides, and fifth is our Devoted Medical Group. So what does it mean to be a next generation? What does that term mean? It's basically used to describe a product that has been developed using the latest technology and will probably replace an existing product. And that's exactly what we want to do, replace the other healthcare providers. As I mentioned before, we want to be the Amazon of healthcare. Just as the Amazon River is the largest in the world, and that's probably why they named the company after it, the Orinoco River is the 4th largest river in the world, and we named our tech platform after that. We have our own in-house tech platform. Our CEO was actually the Chief Technology Officer for the United States federal government and worked for one of our presidents and actually fixed the ACA marketplace system when it was broken. I don't know if any of you recall that or if you were even licensed at that time, but it was a little bit bad in the first year that it rolled out. So our CEO was the one who actually fixed that. So we've partnered with our best-class physicians as well, and we're here to support our physicians partner to deliver the best health care that we can with our members. We're not going to buy any member groups. We're not going to buy any provider groups. We want to partner with those value-based physicians. We're not going to partner with any health providers that are owned by other health plans. And so we're in the process of getting our Advent Health contract in the Orlando market, in Florida, I should say. And so we're careful about the providers that we pick. We don't want to get every doctor in network and then have to say, okay, you know, we're going to let you go the next year. So we're very careful about who we pick, and we definitely are choosy about the providers that we have in network. Devoted Health Guides. Now, I hope that we'll be able to hear this amazing video that we have for you. Our Devoted Health Guides are something that you've never experienced before as a sales agent, maybe even personally in customer service. We're ahead of the curve in that, and it's scaled to grow with our growth. So people might say, oh, if we put, 10,000 new members, you're not going to be able to handle it. We definitely have our tech and data platforms created so that we can grow with our growth and handle all of those new customers that we're going to have. And I'll talk a little bit more about a Devoted Health Guide in a minute. And we also have our Devoted Medical Group, and what that is it's a group of doctors that we have to help support our primary care doctors, especially now virtually, since some providers have not been able to either see their doctors. We can do virtual primary care visits for your members as well. So, and we provide a host of other things for our members with the Devoted Medical Group. It's an internal doctors group, and we're just here to support our primary care doctors. On the next slide, you're going to see, of course, our new technology and what does that mean and why does it matter. So we do real-time fixes. Our claims are processed very quickly within 5 business days, 90% of the time. Our prior authorizations are processed within 72 hours. Our referrals are automatic. Our credentialing process is less than 2 weeks. So if you want to see a doctor in network that we don't have, give us a call, let us know. We'll reach out to them, and we can basically do credentialing in less than 2 weeks, which is really unheard of. We also have links on our website for any doctors that want to join, so please take a look at our devotedhealth.com website and refer your doctors there to be contracted with us. Easy to navigate member profiles for our guides, and review everything in one platform to answer any of the questions. To remember, this means a better experience with their healthcare providers and getting the care they need when they need it. And remember that Amazon updates their technology every 11 seconds, and we're up to every 50. And we say that's too slow. So our goal is to update our tech systems even faster so that our technology can seamlessly assist our members from end to end. On the next slide, we're going to see here is your primary care physician. So basically, Justin kind of showed you some of the partners that he works with. We also work with those same partners, and we have additional primary care doctors in network. We're engaged with those PCPs, many of whom have had contracts which benefit them financially for keeping their members healthy and out of the hospital. Devoted focuses on preventive care, maintenance of chronic conditions. A PCP oversees all of the overall care of that member. So it's a win-win situation. Results which are going to result in better healthcare patient outcomes, improved care coordination, and overall lowering the cost of healthcare. Our goal here is to work with risk providers that really know how to work with managed care patients. We're very selective, as we don't want to add, as I mentioned, a ton of providers and then dismiss them for poor performance. This would create disruption for our members, and we really don't want to do that. So I love this slide. Justin, I'm asking you if you could press play just in case. Maybe it'll work, maybe it won't. I don't know. Let's see. Aww, we can't hear it. Okay, well, we're going to get that out to you. Basically, we don't have any robots. Okay, all of our questions are welcome. We solve your problems. Our guys answer the phones within 30 seconds. They navigate, they're problem solvers, and they're supporters. Anything that you need, your clients need rather, we give out our extensions to our members so that if they have a question or a problem, they can call the same person back. It is absolutely amazing the experience that your members will have during the COVID-19. The whole entire company called all 18,000 members to see if they had a fever, to see if they were sick, if they were coughing, if they had trouble breathing. Every single member, and we text your members. When we welcome them, we text them, and we say, hey, welcome to Devoted. So it's really, really a unique experience for your members, and it's my favorite part of the presentation. And as a previous field agent, I've always said to my clients, hey, call me first, because you never know what the health plan is going to say. Make sure you call me so I can resolve your issues, but we're here with our devoted guides. You don't have to do that anymore. You can be confident that your guides are going to call the health plan, and the health plan is going to take care of them so that you can go out and write more business. So on our next slide is basically just kind of reiterating what we were saying. The proof is in the pudding. The average speed of answered calls was 24 seconds. 82% of the calls were answered in less than 30 seconds. And greater than 80% of members' issues were resolved the same day. And 90% of member issues were resolved within 3 days. So I just wanted to reiterate how our member services guides work. And then finally, we're going to go over a little bit about our devoted health coverage on the next 2 slides, which kind of gives you an overview of the counties of our expansion, the markets that I'm not going to say them all here, but you're going to see where we're growing, and we're getting there pretty quickly. Down below, we're on a mission to 5 stars. So CMS this year said, okay, we're going to have to use your star rating from last year due to COVID. Well, since we were only 2 years old, CMS doesn't really issue a star rating to a health plan 2 years old. However, we were on the mission to 5 stars. And that's unheard of for a health plan to come out of the gate brand new, 5 stars. So our goal is to get those 5 stars, and we're definitely going to make it next year. We do not yet have that star rating because of the COVID impact, but we are definitely trending. We were definitely trending, and we're kind of disappointed that we weren't able to share it, but we had to follow our CMS rules, right? So let's just talk a little bit briefly about our broker onboarding process. This is the simplest, easiest certification you will ever do. Once you get through AHIP, we have already released our 2021 certification. So if you do that, you'll also be able to sell in 2020. Of course, we need your AHIP. If you haven't taken your AHIP, we have an AHIP equivalent that can be taken free of charge, even though, of course, you have to take AHIP for other plans. And with that AHIP certificate, you should be able to onboard in just a few days. The certification timeline on the next page is that basically once you've completed the health product training, it'll take 24 to 72 hours for your license to get verified at the state level, and then if it's denied for any reason, you'll receive a notification. But once it's approved, we'll verify your license number and submit it for confirmation. Once your appointment has been verified, you'll be assigned a ready-to-sell status and be sent a ready-to-sell confirmation. Some things to know for that is all forms, documents, and training certificates will be saved to your personal documents folder. If you upload an AHIP certificate and are rejected or anything like that, you'll be able to find out why, and we'll let you know. We have great customer service support. And our next page is, of course, we're here to support you. Now, everybody says that, but not everybody does it. But we stand behind our word, and myself, I've been in this industry for about 15 years, and I've always been in a supportive role, and now I'm here devoted to help support you. One of the things that, you know, Justin and I have gone, go back a long way, and I've supported his team. I've seen him grow, and he's done an amazing job with his agency. You will be happy that you've joined. You have everything at your fingertips, and together, our partnership together is really going to get you going. So we just wanted to, as far as our member services, agent support team, it's great as well. Our contracting and certification inquiries, you can call us about member ID numbers, verify member effective dates, low-income subsidy, everything that you need, access to devoted agent portals, and the like. Navigation assistance, and all of those other great questions that you're going to have when you get contracted with us. Okay, so the following is going to be our broker loyalty program. So we're excited about that broker loyalty program. It is basically you earn devoted bucks to get some swag, to get some devoted swag. So if you do a couple of enrollments, we're going to give you some devoted bucks, and you write 6 applications in a calendar month, and you'll earn $300 in devoted bucks. Now, that's not $300 cash. That is just, you know, getting you some, you could do order flyers in there. You can order even marketing mail pieces in there. There's a lot of cool stuff that we've placed in there for you, and we're coming out with some super exciting other things for you that I can't mention right now. But the platforms are easy, the easiest certification you'll take, and it's fun too. The certification's actually fun. What marketing assets are available? So you can actually go into our portal. There's all there's just templates in there for you, so you just have to customize them for what you need. Turning 65 mailers, any kind of tabletop materials that you need, and customizable flyers and mailers. So just briefly, our network. So we have all of these great partners, Cano, Central Florida Physicians Alliance, all of these great, and we just added IMA Medical Group, and they will be effective on the 1st of July. In Polk County, if you're selling in Polk, we have Watson, Bond, Geisler, all those big physicians groups that everybody loves out in Polk County. And of course, we're going into the villages in Lake Marion and Sumter, and we have these groups right here for you as well. So will you be a part of this change? We hope so. The most powerful asset we have is love in our hearts. I encourage you to get on the website. I encourage you to join with Justin Jacobs' group and get appointed with Devoted. So thank you.
Thank you, Jeanette. So I have an offer for everyone that's on the call today. I am going to go through that really quickly here. So just a couple more slides and I'll let you guys go. The first thing is we do have an offer of paying for your AHIP for 2021. So how do you get this? If you decide to contract with Devoted Healthcare or come on board with Health Plan Markets, 24 hours from today, I will pay for your AHIP upon your first Devoted application. So once you come on board with Health Plan Markets, we will reimburse you the $125 cost for AHIP and make sure that your AHIP is paid for 2021. So that is available only to those folks that are on the call right now. You have 24 hours to pull the trigger and we'll get you started. We do have a website, joinhpm.com. All the information that I shared with you is available 24 hours a day, 7 days a week. If you are ready to grow, if you are ready to do this now, you have a couple options. You can call us at 844-696-3975. You'll ask for Jessica, and she will send you out the contracting link today. We'll get you started. You can also go to joinhpm.com and fill out our form there, and we'll have somebody reach back to you. Or you can email me, and I can get you started. So either way, we're here to help you. So again, I want to thank everyone for being on the call today. We do have a few questions in the chat box. Some of these are for Jeanette. So Jeanette, we're going to tackle these together. I answered most of them, but I want to just kind of go through it in case anyone is unable to get to the chat box. So first question is what if I have an insurance agency? Would I be able to build a team and enroll agents under me? What does that look like? The answer is yes. We do have agency contracts available. For more information on that, you're going to want to shoot me an email, jjacobs@askhpm.com, and I will take that and talk to you about all the intricacies on building an agency and running a team and the management, and we definitely can set that up for you, and you are compensated for your hard work on that as well. Paul asked, what kind of a relationship do you have with Dedicated in Palm Beach County? So Jeanette, that might be a question for you specifically. What does your relationship look like for Devoted? I can tell you from Health Plan Markets, they're one of our newer partners, but we've already met with the director. They have an incredible marketing team. They've got people out in the field that are hunting down leads and doing events, and we're already committed to a couple of their offices to plug in agents as we onboard with Devoted. So yeah, so what's your relationship look like on your side?
So I know for sure in Polk County we have a great relationship with them. I know that they come from South Florida. We have offices in South Florida. I'm sure that we're contracted with them basically in that area. You just need to go online to our devoted.com, put the zip code in, checking the providers. If you go to devoted.com and look up providers, you can see if they're in network with us. I'm not exactly familiar with South Florida, but if you send Justin your email, I will get the information to you. Or you can go to devotedhealth.com and look up the providers, put the zip code in, and it'll pop right up for you.
Yeah, it's a pretty intricate website. I really like that. So even if you accidentally misspell the doctor's name, it still pulls it up. It's pretty incredible. You know, not a lot of provider searches do that when you're looking at the health plan's provider search. So the answer to that question is, you know, we can definitely help you start a relationship with Dedicated, and they're also known as Chen Medical, so we can definitely help you out with that. All right, a couple more questions here. Let's see. Again, the network is available through devotedhealth.com, so you can definitely check on the network to see, if one of your doctors is there. We can help you connect with them and Devoted. All right. Another question here is Art Cotton still with Devoted? And the last I checked, he is.
Yes, he is. Art Cotton is over in the Palm Beach area. He's actually a director with us. So, yeah, he's still there.
Absolutely. Jeanette, does Devoted have a social services unit? And I'm assuming that's to help people with LIS and Medicaid.
We don't reach out to our members to do that, so we do have access. We're going to actually have a dual eligible plan this year, which we have not had. If you look in our website, we didn't go over benefits today, but you can get with Justin, and we can show you the benefits for Devoted Health for 2021. Currently, we don't have a social services department that reaches out to them, and that can be good, right? Because then you're reaching out to your member. You can call us and find out if they're verifying, to verify the Medicaid status, and you're the one that's going to change them. We're never going to call them, move them, and then become the agent of record. So you don't have to worry about that with us.
Yeah, but they do have the ability to check Medicaid and check LIS.
Absolutely.
So I think that was the main objective, is to make sure that they can call in and verify LIS and Medicaid. And yeah, the answer is that. I don't think it's called social services, but I understood the question.
Got it.
All right. Last question I have here on the chat is, if you are licensed in Ohio and want to build a book of business, how do we get started for leads? So the question there is more towards out of state. I can tell you that we are licensed in Ohio, and that is going to be an expansion area for HPM as well as Devoted. So we are definitely interested in investing in mailers over there. We do great with Google ads. We do great with Facebook ads. So we can work with you. If you already have a book of business in Ohio, you can count on us. We will pay for your mailers. We will help you with, if you would like one of our agent support folks to call your book of business and set appointments for you, we have that available. We have the ability to record a pre-recorded message and send it out to all your clients. We can do that for you. We can send out text messages on your behalf that go right back to your cell phone, and we can do that for you. We can set up email campaigns to your current clients and letting them know that Devoted is now an option in your portfolio. So the answer is whatever it takes, we will invest in you and help you make sure that you get the word out about Devoted. So we can definitely help on that. Another question here regarding Ohio: does Devoted have plans in Cuyahoga County, which is Cleveland? And that is exactly, isn't that the area that they're going into, is Cleveland area?
The county is a hard county to pronounce.
I think Paul nailed it there.
What was it?
Cuyahoga, sounds like. Which is a Cleveland area.
Yes. If you go on to our website, I can't pronounce. That could be it. I just said there's a lot of different counties in. And let me see if it's on our. Let me just see if that county is on there.
Yeah, it's actually the county that Cleveland is located in, and I believe that's the one, because they're starting in the greater Cleveland area.
Cleveland area.
But she's going to verify that for you, Paul, so give us one last second here.
Yeah, and then what I'll do is I'll send Justin the list of our management teams in each market, and then Justin can forward that to you if you want to talk to the local management about that.
Absolutely. Yeah, and I'll make sure to send that out and verify which counties they're going into, but I'm almost certain that Cleveland is going to be the area specifically that is being opened up in Ohio. I was on the call on the main slide deck. I remember them saying Cleveland, but I don't recall the actual county name. So if that's it, that's a winner. All right.
Yeah, I'm trying to. I'll send the information. If you send Justin your email, we can get you that information.
Absolutely. And I'm going to type into the chat box here my email address, so in case anyone has any additional questions, they can go ahead and email me. Whoops. That's my right email. Disregard the first one. I was typing too fast. But again, I want to thank everybody for being on the call. And if you're ready to go, we've got AHIP covered for you. We can get the Devoted link sent out to you immediately. Please make sure you take advantage of all the great services that we have available. And you can, for more information, or if you need a minute to think about it, you can go to joinhpm.com, and we will be there for you. So thanks again. I appreciate everyone for being on the call. Special thanks to Jeanette. I appreciate your patience and your help with this as well.
Thank you.
All right. Take care.
You guys have a great day.
Bye-bye.
Bye.